welcome back to my channel. Today I've been busy this morning making crumpets. I've made quite a lot of crumpets recently. This recipe is from my Harrods book, so posh moi. I'd already made crumpets from my Ritz afternoon tea at the Ritz book and a Waitrose recipe. But I think this one is the best that I've done so far. So that's what I'm doing today. I had it with cream cheese and, well, to be more specific, with Laughing Cow soft cheese mixed with honey and sesame seeds, which was a topping recommended in the book. Not Laughing Cow specifically, just any old cream cheese, but I happen to have Laughing Cow triangles in the fridge, so that's what I used. So that's what I was doing this morning, making crumpets. Because I got some crumpet rings off Lakelands not that long ago. And they're not too difficult to make. Anyway, so in this video, first of all, I want to get onto some of your comments, but first of all, I just want to talk about something that's been in the news recently. It's actually on BBC recently. Quite topical, because it's something I talk about a lot on this channel, about the potential overdiagnosis of autism, and also about self-diagnosis and the danger of social media in that regard. So, a psychologist of the name Dr. Tara Cirillo, I don't know, is that you pronounce it? Her surname is Cirillo. I'm presuming you pronounce it Cirillo, not Cirillo. Assuming it's Cirillo anyway. It might be Cirillo, I don't know. Dr. Tara Cirillo, who has specialised in diagnosing autism for 20 years, warned there is a danger of young people mistaking autism for other conditions which have overlapping symptoms. Off the back of the pandemic, you have a lot of people stuck in bedrooms who might be getting their main information from social media. They might not have the life skills to be able to go, hang on, let me ask my GP or look at the NHS website. Teenagers are increasingly using TikTok and Instagram to self-diagnose with autism and ADHD. Dr. Tara Quinn Cirillo said she has seen rising numbers of young patients in her private practice who believe they have a condition after watching 30-second videos. To quote her, "Actually, one of the things that I'm seeing is a lot of people with different types of anxiety disorders, where they might be getting confused with that being autism. For someone like myself," she goes on, "who has spent years training, it's a bit like a surgeon being told by someone else that they can just tie up a vein and hope they got it right. There's a lot of dangers because there could be other underlying conditions and you need support." Morley Brooks Dridge, who's a social media influencer with autism and ADHD, told the BBC, "Although we have ADHD, that doesn't make us experts and we aren't doctors. Sometimes people self-diagnose because they don't go into the hardcore complexities, and I worry it is just building a stigma of it being over-diagnosed." Okay, so that was what was in the news recently, off the BBC and also in various newspapers. So I've just took some notes, and that's what. Yeah, so I thought it was very topical, because it's something that I have known has been going on for a long time, and if you are on social media, you will be aware of this trend. A lot of people, particularly, it seems, young women, not exclusively young women, and we mustn't generalise at all, because there are men who do this as well, so we mustn't generalise, but it does seem to be mainly young women, are jumping on this sort of bandwagon of self-diagnosing themselves. Actually, it's not just young women. There are some older women who do this too, by the way, and I've seen some older women do it as well. But yeah, self-diagnosing essentially with, and it seems to be the conditions they're self-diagnosed with usually being autism and ADHD. You don't get them doing it with other conditions, strangely. I'm not so aware of this happening with other mental conditions such as schizophrenia, OCD, although some people say I'm a little bit OCD, although they tend to do that more in kind of like flippant kind of everyday conversations as opposed to actually self-diagnosing themselves with OCD. I'm not sure if that actually happens, them self-diagnosing with OCD. I haven't seen it happening that much on social media. it doesn't tend to happen, as far as I'm aware, with conditions such as schizophrenia. It certainly doesn't seem to happen with personality disorders, such as borderline, which I think is now called emotionally unstable personality disorder. And I'm not sure if people do it with that. I think people might do it with depression quite a lot, but then depression is something that is easier for someone to, maybe as it's not, obviously it's a really serious disorder and really serious and people need help for it, but it's a bit more like simplex in the sense that it's a lot easier for someone to know if they are likely to be depressed, I guess, because it's kind of, is literally more based on, can't find the right words. I mean, it doesn't have so many features that can be confused with other conditions, I suppose. So therefore, it's not so problematic if someone claims that they're depressed, even if they haven't been to see a doctor. Although they should go and see a doctor, particularly if they're severely depressed, because they might need medication. But it's not as problematic as someone saying, self-diagnosing themselves with autism, because obviously autism is far more complex in terms of its far more complex in terms of its origins in childhood. It has a developmental history, that depression doesn't, and it is just completely wrong for someone to take such a complex condition that can only be diagnosed by a trained psychologist. And be diagnosed properly, it needs to often take, more than a day, actually. I've heard of some people getting diagnosed within an hour. That always seems to me a little bit odd, because surely it takes far longer than an hour to find out if someone's autistic. I actually requested to see everyone in the team because I wanted my assessment to be absolutely thorough. I didn't want to just be diagnosed with something on one person's opinion. I wanted to make sure this was correct. I wanted to have a thorough assessment so that I could be reassured in my own mind, that it had been done properly. And I think everyone deserves that. Obviously, unfortunately, they are cutting corners and there's a lot of funding cuts, and I'm sure that some people aren't getting a proper assessment like that, and maybe things have been going downhill in more recent years. I know when I got diagnosed back at the end of 2008, beginning of 2009, the waiting list weren't quite so long because the adult service had only just been opened, and I was a young adult at the time, and I was just eligible for using the adult service at that time. And the adult service it was almost like quite, what's the word? A happy coincidence, I guess, that I had just reached adulthood and the adult service had also just come into being. So I was right at the front of the waiting list, and I had to wait about. So I was referred. I think it was at the beginning of 2007. Oh no, hang on a minute. Sorry, not 2007. Sorry, the beginning of 2008. Yeah, the beginning of 2008, because I first asked to see a psychiatrist at the mental health team who could refer me there. And that was a little bit problematic. I won't go into that now. But the second psychiatrist I saw was very good, and he referred me straight away after taking a developmental history. It was the first psychiatrist who wasn't good, but that's a whole other story. Because obviously psychiatrists at mental health teams don't have a full understanding of autism. They're meant to have some awareness, but obviously that does vary. But they're not actually experts in autism, but they can, refer you. They're like the gatekeepers. So the second psychiatrist was very good and referred me. After listening, he took a full developmental history, which the first psychiatrist didn't do. She didn't do her job properly, because you can only really make a call as to whether someone might be autistic by finding out about their childhood, because it's a developmental condition, and that's part of the reason why self-diagnosis is so dodgy, because the only real way you can really know about your childhood properly is to get other people involved who might know you during your childhood. Obviously that's harder if you're older and your parents are no longer around or whatever, but ideally it's good practice to at least, you need to involve other people in something as complex as autism, ideally your parents if they're still around. So Yeah, what am I saying? So yeah, I started a process at the end of 2007, but I was referred at the beginning of 2008. So from the point of referral, it took just under a year. Although from the point of me starting a process, it took a year. So I guess you could call it a year tops, which by today's standards is very good, because now lots of people are waiting in excess of 3 years, and waiting lists are absolutely ridiculously long now. And I also did get some support in the meantime as well. I saw a mental health support worker as well in the meantime. So I guess I didn't get I guess I got as good a deal as you can get. It wasn't too horrendous, based by what I've heard some people have to go through. So yeah, so self-diagnosis is really dodgy. We mustn't do it. I remember when I first was thinking I might be autistic, because obviously my parents had been speculating very strongly that I might be autistic, and they had been doing that for quite a number of years, but I was in complete denial. But when I came out of that denial and I was like, whoa, actually, they could be right, we're onto something here. My mum was always very keen to say, well, look, until we have a diagnosis, obviously we can't be 100% sure. We mustn't claim for diagnosis. We haven't got for diagnosis yet. We need to wait until we've had the assessment, because I knew that it was something developmental, and that was very clear based on the fact I'd been assessed as having special educational needs as a child, so clearly I knew it was something developmental. This wasn't just something that suddenly emerged in adulthood. It wasn't as simple as a mental health problem. It was a clear developmental thing, but until I'd actually been assessed, I didn't know it 100%. I was pretty certain, but I didn't know 100% that it was autism until I'd been assessed, because there are other developmental conditions as well as autism. Dyspraxia, ADHD, specific learning difficulties and other things. Now, it is more than likely that I do have some of those other things. I definitely have a mathematical learning difficulty, and it is possible that I might possibly have some form of dyspraxia, and I even identify very highly with quite a number of ADHD traits. I don't know if I have that because I haven't yet, been assessed. I would quite like to be assessed for those other conditions just to find out to rule them in or out. And I can't self-diagnose because I haven't been assessed. A self-diagnosis is just wrong. It is wrong. I do not understand why people could be so confident in themselves. Like, as I say, before I got assessed for autism, I was pretty, I thought it was a very strong likelihood based upon what I've read. It was a developmental condition that I could see best fit my story, or best fit what I'd gone through. But at the same time, I was thinking, well, yeah, but it might also be dyspraxia, it could be ADHD, other developmental conditions. And until I'd had the assessment for autism, I wouldn't know. And back in that time, by the way, when I got diagnosed, it was in the old diagnostic system where you could only be diagnosed with autism. So if you were diagnosed autistic, you couldn't also be diagnosed with dyspraxia or any of the other things, because autism was seen as the diagnosis that trumped all the other diagnoses. Autism being seen as the more serious diagnoses, I guess. Obviously, those other conditions can be very serious as well, don't get me wrong, and very disabling, but autism being seen as the more complex, and also because it contains little bits of all of the other conditions. So if you're autistic, it's kind of a given you're going to have traits of those other conditions, because it would be strange not to. So you couldn't be diagnosed with any of those other conditions as well as being autistic. That's now changed now. I think that changed 2013. So after I got diagnosed autistic, it changed. So now you can be diagnosed with other conditions as well. Lots of people who are now getting diagnosed with other conditions, who are, they've been diagnosed autistic, and then they think, maybe I also have this or have this, and then they get assessed for those as well. I have mixed thoughts about that. It could be leading potentially to an overdiagnosis of some of those other conditions, where, but obviously if a person needs support. I suppose it all comes down to the question of to what extent is the person affected by the traits that come with those other conditions. And obviously, if the person has really severe traits, then they may well warrant an assessment for those other conditions as well. But anyway, I'm going off track. So I'm going to move over to video number 2 now, because I just want to cover some of your comments pertaining to my earlier video. So move go to video number 2 now.